Okay, Paul, we're now live. You can proceed.
All right, thank you, Stuart. Thank you all for joining us today. Before we get started, we have like to begin with a brief message from Gilbert Martinez from our communications staff for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa organizada por la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretaciones al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con Paul Gluckson.
Thank you, Gilbert. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID-19 and vaccination community briefing for Wednesday, February 17th. We have a lot of information to share with you tonight about our pandemic response and the rollout of our vaccines. Today, we're very happy to have with us Supervisors Corsi and Rabbitt, along with our Sonoma County Health Officer, Dr. Sundari Mase, and Vaccine Chief, Dr. Shende, along with county experts and representatives from our major hospitals. So just to get us started, we will begin with an update from Supervisor Corsi.
Thanks, Paul, and thanks for joining us, everybody. I'm just going to start by going over some of the highlights of the things that our expert panel will be talking about tonight. So first of all, just want to make the point that we are continuing to make progress on two key fronts in the fight against this pandemic. Our case numbers are continuing to come down, and our vaccination efforts are continuing to ramp up. Those are, the two important steps that we have to take here. With our case numbers down, we're able to begin opening up some schools. We're receiving more safety plans from school districts that the Department of Health is reviewing. We know that's very important to residents in Sonoma County. Our vaccination numbers are now approaching 100,000 doses. We still have a long way to go, but we've come a long way to get here. Even with that progress, though, there are challenges that remain. And the main one of those challenges is the limited supply of vaccines. We have the capacity to do more than 3 times the number of vaccines than we're actually receiving from the federal government through the state to the local level. We've got more ability to administer vaccines than we have doses of vaccines. Just as an example, this week our shipment of vaccines was one of the many victims of the terrible weather in the Midwest and back east. We ended up receiving about 400 doses fewer than we expected this week. It means we had 7,610 vaccines on hand to administer this week. With more than 400,000 people who need them and need 2 of them, that's not as many as we need by a far. So supply is a big issue, but even so, we continue to work with our partners in the community to open new vaccination sites. Yesterday, we opened a new clinic at the Veterans Memorial Hall in Sonoma, providing more options and more diversity of locations around the county. And then we still have one major unknown ahead of us, and that's what is the role of Blue Shield? And that organization is the county's or the state's third-party administrator. We're not exactly sure yet what that means. They will be taking over a lot of the vaccine responsibility in Sonoma County starting on March 7th. And just lastly, we need to do more testing. I think that a lot of people are starting to relax a little bit about the pandemic. Our case rates are down, but we're not out of the woods yet. So we want to encourage people to get tests done. These protect not only you, but they protect the community. They get us closer to reopening our schools, to reopening our businesses and reopening our lives. So if you have any doubt about someone you've been near, about how you're feeling, about wanting to take part in something at a proper social distance, getting a test is still a good idea. So I'm going to turn this over now to my colleague, Supervisor David Rabbitt, and he'll talk a little bit more about some of these challenges.
Thank you very much, Supervisor Corsi. I appreciate that. You know, what is true is that all counties in California have been struggling in administering vaccine. And the struggles throughout California and beyond have been widely reported and splashed across nearly every newscast. And the truth is, prior to COVID, our nation had a fractured and splintered healthcare delivery system, which struggled with equity. And we are delivering the vaccine within that same system. The County of Sonoma has been working hard to facilitate and coordinate the equitable distribution with all of our county partners, our hospitals, our clinics, and more. Our challenge is getting 2 doses into each arm of all eligible county residents over the age of 16 as quickly as possible, and that challenge is daunting. That's about 823,000 doses. The challenge is getting enough vaccine. And last week, for instance, we received the most ever. That was 8,025 doses. And as my colleague just stated, just this week, 7,610. So like all counties in the state, we have a math problem. Right now and in the near future, there simply is not enough vaccine to vaccinate all those who were declared eligible by the state. Further, we saw appointments filled up and the vaccine center appointment processes overwhelmed. Our approach was to prioritize within the eligible tiers. Seniors first, who we know clinically have proven to experience the worst medical outcomes, and by the way, place the most pressure on our hospital system. We know that prioritizing within tiers has caused some confusion and frustration, but it was done to provide as orderly a distribution model as possible, addressing those most medically vulnerable. And while we soon will undoubtedly expand the tiers, we believe this approach has been beneficial to the county. And to that end, the proof is in the math, because in spite of what you may read, Sonoma County has gotten more needles in arms per capita than any other comparable size county. That's more vaccine administered than San Joaquin County, for instance, Stanislaus County, Ventura County, San Mateo County, and even San Francisco County. We know we still have a long way to go. However, we are continuing to look for ways to improve systems. But the distribution numbers posted by the California Department of Public Health should alleviate some anxiety about how the logistical feat is being carried out here in Sonoma County. So what's next? Well, as my colleague just stated, and you all know, the governor has contracted with Blue Shield to be a third-party administrator to oversee vaccine distribution and data collection. Sonoma County has been assigned to join this program in the second wave of counties scheduled for March 7th. This gives us the opportunity to see how the rollout with the third-party administrator will go for that first wave of counties, which starts just next week. So to talk about that further and to give some more information, I want to turn it over to Dr. Shende, our vaccine chief, and Dr. Mase, our health officer, to give an update on the state of the pandemic and our vaccine distribution strategy. Dr. Mase?
Great, thank you so much, Supervisor Rabbitt, Supervisor Corsi, and Paul Gullickson. Let me give an update on where we are with COVID. We are still seeing a decline in the surge that we experienced over the holidays. Our adjusted case rate per day per 100,000 residents is now down to 13.8, which is a significant decline from roughly 50 at the height of the surge. That said, we're still in the most restrictive purple tier in the state's blueprint for a safer economy. Our case rate is still double what it needs to be before we can move into the next tier. Once our case rate is below 7 for 2 consecutive weeks, we will be able to move into the red tier, which means we can reopen many areas, including limited indoor dining and fitness centers. I did also want to touch upon our case positivity percentages, which are low. Our overall county test positivity is about 4%, which puts us in the orange tier. And our case positivity percentage in the lower SES 25% group, that's the equity metric, was 5.4%. So we're very close to that being in the orange as well. So we can look forward, hopefully, tentatively, optimistically, to being in the red tier sometime soon. I'm optimistic that if everyone works together, wears their mask, practices social distancing, and gets tested, we can reach that goal faster. Getting tested remains a valuable tool to help us get out of the purple tier. We'll talk more about that tonight. School districts are now able to reopen from pre-K through 6th grade for in-person instruction because our case rate is below 25. But they must have their COVID safety plan submitted and approved first. 11 schools have already either had waivers or their safety plans approved for reopening. Another 24 schools or districts have submitted reopening plans for review. While we're headed in the right direction with our case rate, we should remember, though, that we have to continue practicing the safe mitigation measures like wearing face coverings or masks, social distancing, and general hygiene measures like hand washing. In addition, we really want to remind everybody that there's many COVID testing opportunities that you can use if you suspect that you've been exposed to somebody with COVID, if you're worried that you attended any kind of event where you're concerned, if you've traveled outside of the county. Knowing your status helps you protect yourself and others, reduces transmission, and does move Sonoma County closer to getting people back to work and school. People with COVID may not experience any symptoms, they might be so mild that you don't think you're sick. Testing ensures that you don't pass the disease to friends, family, coworkers when you're an asymptomatic person with COVID. You can get tested at sites throughout Sonoma County 7 days a week. Here are some advantages. Testing is free. Testing is available to everyone, regardless of immigration status. Testing is confidential. You may be asked to show identification, but it's still not required to get a test. And testing results are usually given within 24 to 48 hours. To find a testing event near you and schedule an appointment, visit the testing page at socoemergency.org. Now, Dr. Shende is going to give us an update on our vaccination progress.
Thank you, Dr. Mase. So Sonoma County continues to vaccinate residents in Phase 1A and Phase 1B, Tier 1, with priority given to those over 70 at most of our county-supported clinics. Educators are receiving vaccines at a clinic administered through the Sonoma County Office of Education, and agriculture workers are getting vaccinated at several clinics via their employers. As Supervisor Corsi noted, Sonoma County opened an additional vaccination center at the Sonoma Valley Vets Hall on Tuesday. We now have the capacity to administer significantly more than 3,000 doses per day, but we continue to be limited by the supply that we receive from the state. As of Wednesday, Sonoma County had administered a total of 98,446 doses. That includes 61,672 residents with the first dose and 18,387 residents fully vaccinated with 2 doses. The number of residents with at least 1 dose of vaccine is 80,058, which is equal to 19.4% of the county's adult population, meaning over age 16. We recognize that most appointments for vaccinations are booked at many sites, and we realize this is very frustrating. Again, it's because of the lack of vaccine supply. For those who've made multiple vaccination appointments, we're asking that you please cancel any appointments that do not plan to use in order to free up a slot for someone else to get vaccinated. With that, let's go back to Paul.
Thank you, Dr. Shende, and thank you all. In a minute, we'll go to questions from the public, and I want to remind everyone that you are welcome to submit a question. You can either email them to us at publicaffairs@sonoma-county.org. That's publicaffairs@sonoma-county.org. Or you can just post them in your question in the comments area below you in the Facebook post or the YouTube post, however you are viewing this streamed event. But before then, let me get the conversation started. Dr. Mase, I'd like to ask you, as we've discussed, our numbers are improving. We're inching towards the red tier in the state's blueprint for a safer economy, which means that, you know, we are going to get and hopefully soon be allowed to even do maybe some indoor dining at restaurants and whatnot. But I guess our question is, if we are seeing fewer cases, why is it still important to get tested? Why are we putting such an emphasis on testing right now?
Yeah, thank you, Paul. That's a really good question. And I think a lot of you have been asking that. The reason to get tested is that we still have a lot of cases. We're still seeing 13 to 14 new cases per day per 100,000. That means that transmission of COVID is still happening in our county. And you could be one of the 30% of people, as high as 30% that is, that have no symptoms or have really mild symptoms that you may not ascribe to being sick, and you may have COVID. It doesn't mean you're not infectious. You can actually transmit COVID to those around you, even if you're asymptomatic. So one way, surely, to decrease the transmission is for everybody to get tested. If you are positive, then you can go into isolation for the 10 days, and we can follow your contacts and limit the transmission, further transmission of COVID. The other reason to get tested is we actually get credit as a county for more testing. So the more testing that we do, the state rewards us with an adjustment factor for our case. So if we're doing double the testing of the average testing or the median testing for the state, we get to have our case rate. So now, right, as I said, we're at somewhere around 15 for an unadjusted case rate. If we're doing 900 tests per 100,000 population per day, then we could have that case rate and actually be close to being into the red tier with a case rate of 7.5. Our adjusted case rate is now 13.8 because we're not reaching that goal. We're still doing somewhere around 500 to 600 tests per day per 100,000 population. So our adjustment factor is actually 0.9. So it doesn't give us a great advantage. So, and it's very good that the state is doing that because the goal is to get more people tested, COVID diagnosed early, get people isolated, contacts evaluated, and decrease transmission.
Well, and I think that you raised some great points, but I guess the question is, should only the people who are feeling sick or have symptoms get tested right now? I mean, who should be getting tested?
I think everybody can, may want to know what their test status is. I know that many different venues are offering testing. I would not recommend you get tested only if you're sick. If you perhaps had an outdoor dining experience, then you may have been at risk because even though you were sitting further away from people outdoors, there's not zero risk. So I would say, go ahead and get tested.
Well, my son was just going back to college, and he went and got tested just before going, and he'll be tested many times when he's there as well. But that's
and in fact, many of the universities are mandating weekly testing of the students who are on campus. The University of California system is doing that. So anyways, I think it's good. It's surveillance testing, and it will find people who are cases, even if they're asymptomatic.
Yeah, that's a very good
Paul,
point.
can I follow up on that a little bit?
Yeah, sure.
We just heard that close to 20% of the adults in our county have received at least their first vaccination. Is there any reason for people who have been vaccinated to continue to get tested, to get tested at all?
Yes, actually there is, because the vaccine does not ensure that you don't get COVID. In fact, the studies showed that some percentage of people, even after vaccination, could get COVID. It would just be much milder in form. This is the way with many different illnesses and vaccines, like influenza, for example. So you could still get COVID. You may be less sick, more likely even to be asymptomatic, but you can still transmit it to other people. So even if you've had a vaccination, it does make sense, especially after the first dose, to get tested. I don't know, Dr. Shende, if you want to add anything to that.
No, I would agree with what you said, especially if there is any concern. If there's been some kind of an exposure, even if you've had the vaccine, it is important to get tested. And as Dr. Mase said, especially after the first dose, because we know that full immunity is not reached until 2 weeks after dose number 2. And even in that situation, if one is in a social environment where there is possible exposure, it's a good idea to be tested. There's much less chance that one would turn positive, but it's good to know.
Okay.
Well, if you don't mind, those are great questions. I'd like to turn to Darcy Richardson, Health Services Director of Nursing for our COVID section here at the county. And she oversees a lot of our testing sites. And Darcy, I know at one time we talked about how there was a long wait to get an appointment for testing, and there were also another long wait to get results. What is the situation like now at our testing sites in Sonoma County?
Thank you for that question, Paul. So in general, we have great availability right now for people who want to get tested. And I think it's a really important thing for everyone to know that not only are tests available, but they are one part of the overall strategy to get us out of this pandemic. So one thing on its own is never going to get us out of this pandemic. We have to do everything together. So we have to continue to practice our social distancing and wearing masks and washing hands and doing all of those good things that we've been doing for so long and have been very successful at. And we need to get everyone vaccinated. And at the same time, we need to continue testing people to make sure we're finding everyone who's sick and getting them isolated as quickly as possible so they're not transmitting to their coworkers or their family members. Because we're still seeing outbreaks, we're still seeing transmission in households, and we would like to reduce that to the extent possible. So knowing what your status is really important, not just for you, but for your coworkers and your family and friends, as everyone has already said. We have our OptumServe sites, we have our curative partners working throughout the county to test people. We have other testing providers, and the county is doing testing through the Shende drive-through for people who are contacts of cases. All of those facilities are available. We have a very short turnaround time now. It's between 24 and 48 hours. Appointments are available every day. You can go online and get an appointment, or you can call our hotline and they'll help you get an appointment. You can go on SoCo Emergency and find out where pop-up events are happening through the community clinics. So we have lots of options available. And the other thing I think that people are sometimes a little reticent about is that they got tested very early in this pandemic and everybody was doing a nasopharyngeal swab, the one that goes all the way back to the back of your throat. And that's sometimes very uncomfortable for people. Now we've switched to doing a lot of the nostril swabs. So it's much more comfortable. It's much less painful. A lot of it is self-administered. You can still choose to get a nasopharyngeal swab if that's what you prefer, but there are other options. It's fine for kids. It's fine for everyone else. It's not very uncomfortable at all. I've had it done a couple of times, and I can tell you that it's much more pleasant than the nasopharyngeal. So I really encourage people to go out and get tested if you're out and about in any way. If you're going to school, if you are an essential worker, or you work at a grocery store, or you're just out in public a lot, in particular, those are the folks who are at risk of getting exposed the most and should be tested on a regular basis. Even if you've been tested before, it doesn't necessarily mean you're still going to be negative. So continue to get tested on a regular basis, and then we can really control this pandemic.
I heard of somebody who went in today. You can walk in and get same day appointments and get your results pretty quickly. Just want to remind people that you can go to socoemergency.org, and there's a list of places to get vaccinated with links on how to make an appointment. So that's a great source for getting that information.
Paul, can I make a comment just to drive this point further home? Because I do think it's really important. You know, Dr. Mase mentioned our case rate, dropping precipitously. But the reality is, each and every day, 65 people within this county are tested positive for COVID. 65 people's not a small number. 65 people who can go out and spread the virus to their family, to their loved ones, to someone vulnerable within the community. And I know that right now, everyone's focus is on getting that vaccine appointment. The reality is, for a lot of us, myself included, the vaccine's not going to be around the corner. This household, I think we did 4 tests this last week alone. We're going to continue taking those tests until right up to the point where that vaccine appointment is made. So as was mentioned by Darcy, if you're out and about, you really owe it to not only to yourself, but to your loved ones, to the community, to make sure that you're safe, that you're not spreading COVID, that you're not going to be sick yourself, tying things up. I know that everyone's excited about getting the vaccine, but it is going to take a little bit of time. And don't wait on your heels while at the same time having people exposed. So thanks, Paul. I just thought we would put it right out there once again.
Yeah,
And
no, that's a really good point. You can't say that enough. This is no time to ease up. Yeah.
Can I just say one more thing? Sorry, Dr. Goitfriend. I just wanted to say there's another reason for people to get tested right now, and that's because of the new strains that are circulating. So a lot of you have heard in the news about new mutations of the virus that make it more transmissible. And one of the things that's really important in terms of controlling the pandemic is making sure that we are on top of what strains are circulating in our county. If we don't have people getting tested, then we can't do that genotyping to look for those new strains from South Africa, from the UK, from Brazil. So it's really important for us to know what's happening to be able to mitigate and stop that transmission as quickly as possible when we start to see those new strains that are highly transmissible and could make all of these wonderful vaccination efforts less effective than they are right now.
Yeah, excellent point. Well, I now do want to turn to, we have a couple of our medical professionals from our healthcare partners. We have Dr. Catherine Goodfriend from Kaiser, who is the Kaiser physician in charge and COVID testing leader. We also have with us Dr. Rundiway from St. Joseph Health. And I think I'll go to Dr. Goodfriend first. Are you seeing, what are your thoughts? And are you seeing a decline in testing at hospitals as well?
Thank you, Paul. So yes, we've definitely seen a major decline since the holidays. I was somewhat nervous about the Super Bowl, but it didn't peak up a lot. And one thing I wanted to follow up about the nasal swab is that it depends for patients that may be getting one. And I really want to emphasize, if you have symptoms, have been exposed, please go get tested. But whether or not you're swabbed in the front of your nose or the back of your nose depends on the type of swab that the testing facility has. So we're not trying to torture anyone with doing the back of the nose versus the front, but it totally depends upon what swab we've received. But I'm really happy to say that we've seen a major decline since the end of January, and I really hope that COVID is on its way out. But continue to wear your mask, social distance, and even if you have a vaccine, do not let down your guard. Thank you.
I think that's a unified message. Dr. Rundiway, I hope I'm pronouncing your name right. Did you have some thoughts you'd like to share?
Yeah, thank you for giving me the opportunity. Yeah, no, I agree with all that has been said by my colleagues over here. It's important for us to keep our guards up at all times and not get complacent with the recommendations of wearing a mask and getting tested. We need to continue to get tested. Even if you are vaccinated, you could still potentially be a asymptomatic carrier, and you could still pass on the virus to someone who has not received a vaccine. So it's really important for all of us to keep our guards up and keep on getting tested, just like other people are noticing. I mean, our numbers also in our testing center, as our respiratory clinic, have been quite down. Where, thank God, we are not seeing that many patients in our clinics with respiratory symptoms who need to be tested. So that's a good sign, all in all. But again, we need to be vigilant, and we need to keep testing, and we need to keep our guards up, is my message.
Thank you very much. I think that's an important part, a point to make, is reminding people that the vaccine does not prevent you from getting the virus. It mainly prevents you from getting severe reactions to the virus. Isn't that right?
Yeah, that's correct. And even in the studies, it was found that especially after the first dose of vaccine, many people actually did get COVID. So, and even after the second dose, we're not sure, but some percentage of people would still get the disease. It's just that they don't get as sick with it, and hospitalizations and bad outcomes were much, much less after vaccination. Doesn't mean though you can't transmit it to others though.
Yeah, I think that's, I think that, it does explain even why, people who get vaccinated are being encouraged to continue to wear masks, that they can still spread. Dr. Mase, just on a final thought here, how far along do we need to be before we can start to relax and put down our masks? I mean, we're not there yet. We know that, but do we need to get all the way to herd immunity? Do you think? What are your thoughts?
I think it's a really good question. As we've been saying from day one, it is a novel coronavirus, and every time we do something new, like now vaccination, we need to see what the impacts are. So we don't have all the answers. I think herd immunity occurs when, from different reports, up to 60 to 80% of the community has antibodies to the virus. So maybe when we get to that point where we've vaccinated 60% of our community, we're going to start feeling like we made a lot of progress. I want to err on the safe side for our community to minimize the bad potential outcomes like death in our population that's over 65. So I think we need to just continue with these mitigation factors well into when we've finished vaccinating at least 60 to 80% of the population. I don't know, Dr. Shende, you may have something to add to that.
No, I completely agree. And I think what's unusual about this virus is it's unlike any other, because we haven't had other viruses that are completely asymptomatic and yet capable of transmitting a virus. So there's a lot we still have to learn, and it's going to take time. And because of that, we need to continue vigilance and continue.
And lastly, as Darcy noted, the variants are another factor. If we have more and more variants that arise, mutations in the virus, some may not be as prone to not taking hold even after vaccination. In other words, the vaccine may not be effective for some percentage. And so we do need to, I think, wait and watch and see what happens. But a good strategy is try to get as many people vaccinated as possible before we have a lot of variants that have been introduced in our community.
Dr. Randiwe, did you have a point you want to make? Did you want to? You had
Actually,
your hand up.
Yeah, it's more of a comment and a question to my colleagues over here on the panel over here. I mean, yes, I totally agree with the mask and all of that, wearing a mask at all times, especially during this pandemic. But I would like to hear what your thoughts are. Even, let's say the whole county is vaccinated, still continuing to wear masks, because we have seen a reduction in other diseases, other viral infections. Let's not forget the common flu virus still kills about 25 to 30,000 people on a yearly basis. And we have seen a reduction in that by wearing the mask.
That is an excellent point, Dr. Ranadive. And I just want to underline that. How many of you have gotten the common cold, for example, in the last 11 months since you've been wearing a facial covering or a mask? I personally have not, and I'm usually very prone to those. So I think it's something to consider, because influenza, other respiratory viruses this may be very effective for preventing respiratory illness. I see that Catherine, you're nodding your head as well. Anybody else want to add to that?
Well, I know in my clinical practice, I normally see a lot of colds and flu symptoms, and it's really nice that we haven't seen that. So I'm all for masks, and you can color coordinate with your outfit.
Well, I think we all agree that masks may be with us for a while, so don't throw them out. I want to get to the questions from the public, if you will. And there's a number of questions that we've received concerning our how close we are to getting the red tier. And Dr. Mase, maybe, or you or Adam Redkey could help explain, is it what David asks, is it possible to move to red tier with just a low positive test rate and a good equity number? Is that a combination that'll get us there?
Yeah, and I will turn it over to Adam in just a minute to confirm, but if our positivity rates, that is the overall county positivity percentage, and the percentage for the health equity metric which is the positivity rate in the lowest 25% socioeconomic status for our county. If both of those are in the orange tier, that'd be less than sort of, I believe it's 5.2%. Then even if our case rate remains in the purple tier, that is above 7 cases per day per 100,000, we can move into red. That's the way the state has sort of framed this. Adam, if you want to add, I'm not quite sure if the overall testing positivity needs to be under 5.2 or 5. You probably know that.
Yeah, so to qualify for the orange tier for the overall test positivity rate, that would be at least 4.9%, which we currently qualify. And then the health equity rate has to be 5.2% or less, which we don't currently qualify for, but I believe we're pretty close, and Kate can confirm that. The only thing I would add to what you said was that we would have to meet the metric for 2 consecutive weeks, and then the state will move us formally into the red tier, and that would immediately allow new activities and businesses to reopen. Kate, do you have anything to add?
No, that covers it. I was just going to mention the 2 consecutive weeks as well, but you addressed that.
Well, thank you. Well, we are getting close, and that is exciting. The next question comes from Anne, and this is a pretty big question. She asked, can you explain more about the Blue Shield situation? What will Blue Shield take over? Will the Blue Shield take over what the county is handling now in terms of vaccines? Dr. Shende, do you want to take that one?
Sure. So what we know so far is that the third-party administrator, Blue Shield, will be active in Sonoma County as of March 7. What that means is that they are going to help us to distribute vaccine, but with input from Sonoma County. And they are also going to help to clarify the data by having everybody join one consistent platform for data entry, as well as for vaccine administration, as well as scheduling appointments. And it's going to help us to help everybody, the county, the state, everyone, to be on the same page, to have better information and clearer information. At this point, we don't have further details. What we understand is that vaccination is going to continue, and it's going to increase. The rate will be increasing. Hopefully, we'll have increased supply over the next few weeks as well. So there's some technical details that are involved with this whole process, and they're going to play out over the next few weeks. But the big issue is that we're going to a consistent system, which is going to help with vaccine information.
Yeah, and just to be really clear, just to add to that, we are doing really, really well with vaccinations here in Sonoma County. So when the third-party administrator, that is Blue Shield, comes on board, they intend to work through the mechanisms that the county already has in place and follow our direction, because we've been so successful already in vaccinating folks that they would like to work with us and just augment that. And as Dr. Shende said, that collecting the data efficiently, timely, and having good data to report on is really one of the big initiatives for the third-party administrator.
Supervisor Corsi, did you have?
Yeah, just wanted to follow up question there. Will the administrative role of Blue Shield extend not just to the county's operations, but also to the various hospital chains operations? Will everyone be under the administrative arm of Blue Shield?
It appears that St. Joseph's and Sutter will be, but Kaiser is also going to be a part of this equation. And I don't know if Dr. Goodfriend wants to jump in, but it seems like Blue Shield will be one big part, and then Kaiser will also be playing a part.
Dr. Shende is correct about that. A lot is going to be playing out, but you know, we, along with everyone else, want to be as equitable as possible and get as many people vaccinated. So we shall see.
Paul, if I may, I had an excellent conversation this morning with the chair, the Assembly Member Wood, who's the chair of the Health Committee, who had a great conversation with Blue Shield. And as he's described himself, and I think you know, he's skeptical by nature. He hammered them with questions, and they answered each and every one. And he was calling me to let me know that he thought for our county that this was third-party administrator was actually going to be very beneficial. And he did think that the backbone of data will be something that is really going to be what they're really striving for, as especially probably more so needed as we really ramp up exponentially the amount of vaccine coming into the county and getting into arms. So I just wanted to report that and thought that that was a good recommendation by a good person who knows the entire field.
That's great. That's very encouraging. So thank you. Well, we are planning to devote one of our upcoming Wednesday briefings, perhaps next week even, to the issue of the transition to Blue Shield and what that is going to mean for Sonoma County. So we hope to get into that in more detail, particularly as more information comes along. Darcy, I have a quick question here from Melissa, who just asked on the issue of testing, how many tests are being done daily now in Sonoma County? Do you have that number?
Well, it varies, but I think we're around 3,000, 3,500 tests per day.
Paul, I can speak to that if you'd
thanks. Thanks, Kate.
Sure, thanks, Kate.
Sure. Our testing volume per 100,000 residents, lately it's been around 490 tests per 100,000 residents per day.
Great. Well, we probably have room to grow a little bit, but that's great. Thank you very much. Let's go to some of our media partners. They have some questions. Let's start with Phil Barber from the Press Democrat. Phil.
The disruptions in the vaccine supply chain caused by this winter weather hitting much of the country. Dr. Shende or anybody. I think Supervisor Corsi said 400 fewer doses than expected this week. Is that the correct number?
Yeah, there's a lot going on there. So first of all, the inclement weather has caused all sorts of problems, and doses were not able to be shipped out. So they still are at the production site. Some of the Pfizer doses were. So there's a delay in the shipment and obviously in the arrival, and that's going to impact some of our clinics in terms of whether they will have vaccine to be administered. The other issue is, yes, we just found out about our weekly allocations this morning. And technically the number is about 400 less. However, there was a change in the way they are accounting for the Pfizer doses. As you may have heard, with Pfizer, you can eke out at least 6 doses per vial, as opposed to the 5, which originally they had accounted for. And so as of this past Tuesday, they compensated for that. And so once you do that additional math and you look at how many actual doses we are receiving, we're actually receiving 1,000 less than we did the week before. So it's a tough week. And hopefully next week will be better. But that's where we are right now.
If I could share also, our team has reached out to all of our healthcare all of the vaccine administrators that are using or that have clinics scheduled this week to find out if they believe that there will be any disruption. And at this time, they do not anticipate any clinic disruption. They're monitoring it closely, and we've talked to various clinics about sharing if necessary in order to not cancel any appointments if possible. And we're working on that closely with our clinics.
Thank you both very much. The 1,000 fewer doses total, Dr. Shende, does that include allotments to the MCEs in the county, or does that exclude them?
No, that's just a distribution to us, to the county.
So how do you determine how to distribute the 1,000 fewer doses? Will it be sort of proportional amongst all the many partners the county shares those with? What's that process like?
Yeah, so typically the various allocating partners will put in requests for the following week. And given that we're all in the same boat, we will be having to decrease their request or what we're able to give them proportionally. Yes, that's essentially what we do.
Okay, thank you. And then if I could just follow up on what Ken just said, as far as it stands right now, do you know of any cancellations or postponements of appointments at any of the county supported clinics for this week?
And the answer is, yeah, we have called the clinics, and at this time there is no cancellations of any clinics at this time. We're going to have to take it day by day and look at the doses that are at various clinics. If there are doses left over at one clinic, we may see about moving them to another clinic. The clinics work very, very well together to ensure that continuation of operations.
Great, thank you. I might have a follow-up or two, but I'll give my chair to other reporters. Thank you.
Okay, thanks, Phil. Let's go to Carl Van Amberg. Carl?
Yeah, hi everybody. Had a question that would just follow up on the the Blue Shield kind of takeover, at least of the administrative portion of vaccine administration across the state on the 7th in our county. Any idea, and obviously a lot of things are unknown right now, but any idea at this point whether the existing infrastructure that was put together so meticulously and over a period of time here in the county, all of the sites, those sorts of things will remain in place? That's A. And B, if there is a idea that the way people would schedule appointments, such as My Turn California, whatever, would change, because a lot of people are going to the SoCo emergency site as a central spot to schedule appointments. Do you know if either of those things will change in terms of infrastructure or scheduling appointments? Anybody who knows?
So I'll start, and then Ken can jump in. I can see he's ready to jump in. So in terms of the infrastructure, Blue Shield has assured us that the network that we have established, which has worked so well and has been so collaborative, will continue. And they want to work with us to ensure that what we have built will continue to function the way it is. In terms of the scheduling of appointments, we will be going to My Turn, and most likely it will streamline the appointment making process. And there's still maybe a few, everyone may not be able to go to My Turn right away. And they made it clear too that if it takes a little bit longer for some, that would be all right. So it may take a while before we're all on the same platform, but eventually that would be the goal.
Okay, great.
Anything to add, Ken?
No, perfect.
If that's the case, I just had a quick follow-up, and that would be in terms of the mass vaccination drive-throughs that were envisioned at one point in Sonoma County. Any idea or thoughts on whether that will become a reality under the Blue Shield administration across California, but specifically here in Sonoma County?
If I could, there's no guarantee of anything, but I could certainly envision and have talked about the possibility of having at least a mass vaccination drive-through at some point. And I believe some of the discussion that we had with Blue Shield would support that we could do that.
Okay, great, thanks.
And if I could add something, patients do need to be monitored after the COVID vaccine for potential reactions, though they're very, not often at all. So it's not like the flu shot that you can get your flu shot and walk right out the door. So that's important to know, that patients need to be monitored for a minimum of 15 minutes after the vaccine. So anyway.
I was just going to mention too, if I may, that thanks to Ken and the logistics work, we have the ability to have those drive-through mass vaccinations. We're only limited by the vaccine itself. And so I'm going to be optimistic and say that one day soon, we're going to receive exponentially more vaccine, and we're going to have those facilities ready to go. And that's what really, again, the county's role is to make sure that once that rolls through, that we have a way to get those shots into arms as quickly as possible, working with all of our colleagues, of course, throughout the county. So I'm going to be optimistic. I'm looking forward to that. And it won't happen in the near future, but I feel that, with the concerted effort at the federal level and at the state level and working through Blue Shield, that it could happen in relatively near time.
Yeah, if I could share, we were very early adopters of drive-through testing and put together a very successful drive-through testing site using our own teams. And so we have the experience in this area. And so we literally are just waiting for the opportunity to put that in place.
Okay, thanks.
Okay, thank you, Carl. Let's go to Martin Espinoza from the Press Democrat. Martin.
Hi there. So I'm working on a story for later in the week about variants and our county's participation in the federal and state surveillance programs, the federal NS3 program and the state's COVIDnet.net. I had a chance to talk to Dr. Rachel Reese, who said that we've been sending samples since January 14th to the federal program. Have we gotten any word yet about what the results of those are? Do we know how long it's going to take to get back some information after we've sent it to them?
Yeah, thanks, Martin. I have not heard any results of the genotyping at this time, and I see Dr. Baldwin's on, so maybe you may want to discuss this further.
Yes, hi, Martin. No, we have not received any results from the samples that we sent to the CDC. And frankly, it's like every other federal thing, it's slow sometimes. So it may take a while for us to get those results, and they may have to go back through the CDPH, and then those results come to us. So we're working on trying to close the loop and reach out and find out what the results were of the samples that we sent. But we have not received anything yet, and that's the status right now.
So the Biden administration announced today that he was going to inject about $200 million in this kind of sequencing and the work that the CDC is doing. Do you know if that's going to allow us to increase our samples from 4 every 2 weeks? I think is what we're limited to for that surveillance program.
It may, if there's more laboratories or more machines to do the actual genotyping and sequencing, they may be able to accept more samples from around the country. But as far as I know, they haven't, we haven't gotten any updates from them yet on increasing the number of samples that we send. I'm really excited about the opportunity to use the state lab and send our samples there when when we're able to start that up, which I hope will be sometime soon. And we should be able to get those results in a more timely fashion.
I understand there's no limit on the state's program, but I did just want to ask Dr. Mason or anybody else if there's any, why is it important to determine whether or not we have variants? What do we learn from I mean, my understanding is that it's a virus that's constantly evolving, right? And it allows us to stay on how that virus is changing.
Yeah, thanks for the questions, Martin. So I certainly hope we can scale up genotyping, because the more specimens that we can get genotyped, the better understanding we'll have of what's happening on the ground in terms of mutations in the virus. And the reason we want to know is because we know that viruses often mutate to get advantages in the way that they can either infect people, or the transmissibility, or how virulent they are. And that's kind of as a result of some selection sort of towards fitter strains of the virus. So it would be really good for us to know if we've got these variants that we need to be concerned about, because they could cause worse disease. They could be easier to transmit from person to person, and they may not be as responsive to our vaccines. The one reason why every year we get an influenza vaccine is because that the influenza viruses, they mutate over the year, so that the previous year's vaccine is no longer quite effective against them. So that's another reason why we want to know whether we have mutant strains, whether we're going to need to modify, make changes, or have a different vaccine for the next year.
Thank you.
Okay, let's go to Daniel Tricios, KSRO. Daniel.
Hello, thank you for taking my questions. It's more kind of a statistical inquiry that I have. It was mentioned earlier in the presser, if I'd written it down correctly, that we are roughly just distributing about a third of our capacity for vaccines at this present time. I kind of wanted to get an idea, what is, if supply wasn't a limit, what would be our max distribution of vaccinations, and what is it currently?
Ken, do you want to take that one on?
Yeah, let me take that on. So let me start with currently. I'm gonna bifurcate between the county sponsored clinics, or the county supported clinics, versus the hospitals themselves. At the county supported clinics, currently we're running approximately 2,000 to 2,400 vaccines a day through our own clinics. The estimated capacity for those clinics are somewhere around 4,000 to 4,400. Now, honestly, I've estimated conservatively. I've talked to our partners, and we believe that at full capacity, and when they've got some experience, a lot of experience under the belt, they could probably run as close to 7,000, as much as 7,000. You add to that, for example, Kaiser has stated that they can give as many as 2,000 a day, and other providers that may be able to provide vaccines. I would think that our maximum upside could be somewhere around 10,000 a day.
That would be 10,000 a day between the county and the private providers, correct?
That would be between, no, remember the county isn't administering vaccine. That's between those providers that are operating out of county supported locations and the hospitals. That's a high point. I would say 7,000 to 8,000 would be realistic on a daily basis. But I think given some, we could go as high as 10, I believe.
That's all together.
All together. Dr. Shende, am I missing any other providers that in that estimate? Yeah.
Yeah, that would be with the MCEs.
With the MCEs, with all the providers.
Okay, and then actually just kind of moving on also to the testing question. I think this was broached a bit earlier as well, but just kind of in specific numbers. You know, how much again was is there testing currently happening per day, per week, and how does that compare to like testing within the last month or last month in January, and also versus the whole all-time high of peak testing?
Would you like me to respond to that?
Sure,
So
that'd be great, Kate.
Okay. So looking, using the figure of looking per 100,000 residents, we saw our peak in testing. I believe it was back in November. People tend to get tested more right before holidays. And I think it was right before Thanksgiving or so. I think we hit about 680 per 100,000 per day. During the holidays, we tend to see a dip. Most recently, what we saw were that tests were high right before the Christmas holidays. They dipped down low. They went up again as people, came back from their holidays or wanted to get tested after their gatherings in early January. Since that time, when we saw test rates go back up, they've been steadily declining. And that's across all of our providers. We've seen a decline from about, 600 or so tests per day, or, 3,000 or so tests per day, looking, across the whole county, down to levels that are more around 1,000, 2,300 tests per day. So yeah, we've just, it's since early January, it's been a pretty steady decline.
Thank you.
Okay, let's go to Susan Walbarst. Susan?
Hi, thank you. This is a granular question after all these global questions. This morning, I noticed on your website, you had 0 cases for today. And I wondered if that was an error or a data lag or something, because I've never seen 0 cases before.
Hi there. I can speak to that one as well, if that's okay. So that was not an error. There were actually 0 cases that came through yesterday. I think it remains to be seen over the next couple days or so, whether that may have been due to less people getting tested over the four-day weekend. Processing of those labs, but it was an accurate figure. We also reached out to the state data system just to confirm that there was nothing going on with their system, and these really were the results that we were seeing, and they confirmed that it was correct.
Thank you.
Susan, that was a very good question. It was certainly one that we were all asking today, because nobody really believed that we were at 0, but we all hope we can actually keep that. That's one trend we'd like to keep up. Listen, I know there's a lot of questions out there. It was a really good discussion tonight, but we're going to have to wrap this up. We're past the hour mark. I really want to thank all of our panelists for joining today. I also like to thank our crew who helps us out every week. And I want to call out in particular Jordy, our Spanish interpreter, and Elizabeth, our ASL interpreter. We encourage everybody to go to socoemergency.org/vaccine for information on our vaccination rollout and how to get appointments at clinics when they're available. We also urge you to continue to follow County of Sonoma Facebook page, as well as follow us on Twitter for regular updates. And finally, we also hope you will join us again next week, next Wednesday at 5 o'clock for another one of these live community briefings. Until then, have a good week and stay safe, everybody. Thank you.
Thanks, everybody.
So.
Thank you.